interim? Okay. Why don't you want a chair? I look ugly.
No more than normal.
So you already approved the minutes, they're actually.
Okay, welcome everybody. This is the Child Welfare Oversight and Advisory Committee meeting. Today is Thursday, July 21st, and it is 3 p.m. Secretary, please call the roll.
Senator Berg. Senator Harper Angel.
Here.
Senator Storm.
Here.
Senator Westerfield.
Here.
Representative Banta.
Here.
Representative Raymond.
Here.
Representative Stevenson. Representative Tate.
Here.
Representative Beckler.
Here.
Co-Chair Meade.
Here.
Chairwoman Adams.
Here. All right, we have a quorum and we are authorized to do business today. The first item on our agenda is item number 2, approval of the minutes. Those should be in your packets in front of you. And I will need a motion and a second in order to adopt those. I have a motion, I have a second. All those in favor of approving the minutes signify by saying aye. Aye. Any opposed? All right, the minutes are approved. All right, so very exciting meeting today. We are going to look into Senate Bill 8 and get an implementation update. And it looks like we have a couple of people that are going to present. Heather Wagers, if you can make your way to the table. And I know that you do have anyone with you.
No, ma'am, just me.
Okay, so Heather, I have you and Mary and Kelly and Laura, and I didn't know if do y'all want to? We're going to do it individually then.
Yes, ma'am. We have different presentations.
Okay, perfect. Let's go.
Thank you to all the individuals gathered here today to serve on the front lines in the fight to prevent child abuse. My name is Heather Wagers, and I'm the Executive Director over the Office of Trafficking and Abuse Prevention and Prosecution within the Office of Attorney General. For too long, Kentucky has ranked top in the nation for incidences of child abuse and neglect. We currently have the 5th highest rate of incidences of abuse. According to a report by the Cabinet for Health and Family Services, child deaths and near deaths from reported abuse went up 22% in 2021. Now, there was an overall decline in reported child abuse that began in 2020 and continued in 2021. That is likely attributed to the circumstances surrounding the pandemic, not because an actual drop of child abuse. I don't have to tell you that no child should have to grow up in this type of world. The General Assembly responded to the needs of Kentucky's children with the passage of Senate Bill 8. Prior to Senate Bill 8, the Child Victims Trust Fund was focused on limited scope of prevention programming. With Senate Bill 8, the scope and composition of the board changed along with the name. The Child Abuse and Neglect Prevention Board was formed to focus on all forms of maltreatment. And here are some of the members included on the board. So we have the Secretaries of the Cabinet for Health and Family Services, Education and Workforce Development, Justice and Public Safety Cabinet, the Commissioner of State Police, and the Attorney General. We also have several voting members from community organizations throughout the state, including Kentucky Youth Advocate, Prevent Child Abuse, CASA, the CACs, Children's Alliance, and so forth. The Speaker of the House and the President of the Senate have appointed a member to serve as a non-voting member, and so we have Senator Julie Rocky Adams, who sponsored Senate Bill 8, as well as Representative David Meade serving on the board. So the board has several responsibilities set forth in statute, and so I've tried to summarize them here, but a large part is coordinating the exchange of information and establishment of child maltreatment programs, prevention programs, trying to publicize and make people aware of the Child Victims Trust Fund, reviewing expenditures, and so This board is administratively assigned to the Office of Attorney General, and so I provide administrative support out of my office for this. And so we do site audit visits across the state. I'm working with our partners trying to figure out the best way to share information so that we can all collectively work together. I should go back, and one of the things that we now do because of Senate Bill 8 is publish an annual report of recommendations to reduce child maltreatment. That is a new addition to with the inclusion of Senate Bill 8. The board has been very successful in the past, and so I just wanted to kind of highlight a couple of the things that we are very proud of, the work they've done. And so the Are They Good for Your Kids campaign, it was sponsored by Prevent Child Abuse, but it was funded through money from the Child Victims Trust Fund. The campaign has received more than 5 million impressions on social media. It also received an amazing award out of Lexington for the amount of attention that it received in that community. Some others are Family Nurturing Center. They provide stewards of children training to 2,000 adult community members in the past year, which 91% of them showed that they had become more informed about ways to reduce child maltreatment from those trainings. ECHO, so Exploited Children's Help Organization, they provide training and evidence-based training in Louisville area. And so from the past year, they have trained over 3,600 children and over 1,200 adults in Jefferson County. South Central Kentucky Kids on the Block also provide training. So they have a puppeteer program, and so they go into the schools, elementary schools, either virtual or in person, and they raise awareness about the different types of abuse. They talk about the differences between discipline and abuse, and they talk about knowing who a trusted adult is to raise awareness so that if something happens, that they know who to go to. And so this past year, they trained over 6,000 children just using the Child Victims Trust Fund money. They also have other means. They've trained other people off of that, but just focused on Child Victims Trust Fund. And from those Child Victims Trust Fund presentations, over 26 child abuse disclosures were made. And finally, our fifth prevention programming partner is Child Watch Counseling and Advocacy Center. It's the Totally Awesome, Super Important You Abuse Education and Prevention Program. And so I took a picture from their Facebook web page where they did this in the Benton Elementary School out in Western Kentucky. The Child Victims Trust Fund also provides reimbursements for child victims of sexual abuse for their medical exams at the CACs, the Child Advocacy Centers. And so I just wanted to give you an overview about how that comes in. I know we get a lot of questions as, did we see a dip in the exams performed? And so that's why I've got 2019, 2020, 2021, and now the very beginning of 2022 as a guide. And so you will see in April there was a dip in 2020, but that it's rebounded. And in some instances, we're seeing, like in March of 2022, we saw more in March than we had previously in the past 3 years.
Can I ask a quick question on that?
Yes, ma'am.
Do you anticipate the reimbursements from the trust fund going down because we funded more money in the budget this year? Okay.
Well, so also with the inclusion of changing the definition about how Child Victims Trust Fund working with Medicare and Medicaid to make sure that that bundle amount is going to be different. And so I think that that amount will be decreasing. But until that gets all worked out, we're just going to be here to support them in the meantime.
Perfect. Thank you.
And so in 2019, 632 exams were reimbursed to the CACs across the state. There are 15 child advocacy centers. In 2020, 499. And in 2021, and these are fiscal years, 561. Speaking up for our most vulnerable Kentuckians is a responsibility that our office takes very seriously. Within months of taking office, Attorney General Daniel Cameron joined the Kentucky Youth Advocates and COSAIR Charities in convening a roundtable of stakeholders to discuss how we could work better to come together for Kentucky's kids. My office has traveled across the state and the Commonwealth, meeting with partners and organizations to exchange information and develop public awareness regarding the prevention of child maltreatment. Here are just some of the many events. We had a resource fair in Frankfort, a health and wellness fair that we participated in Manchester. We're going to be at the Nest Family Fun Day in Lexington this Saturday, as well as Family Fest in Moorhead next week. So these are all typically staffed by the Office of Attorney General employees on behalf of the Child Victims Trust Fund. Typically, the board members haven't been able to, in the past, come. We always make them aware of the event so that if they're interested, they can come out and join us. But in the meantime, my staff is out there, and we're trying to raise awareness about the Child Victims Trust Fund. All right, now Senate Bill 8. It became effective April 1st. We held a meeting on April 14, a special meeting, so that the existing board prior to could vote to dissolve. That way they could know about what was going on and everything that the impact of Senate Bill 8. They were overwhelmingly very ecstatic about the opportunity for the board to cover all forms of child maltreatment. And so while some of them were sad to no longer be members, the majority of the focus was that this is going to be given to help all kids who are suffering from child abuse and neglect in Kentucky. We had already established a grant application deadline for April 20th. We did know that Senate Bill 8 was coming through. We weren't sure exactly when it might be passed or when, if it would be signed off on. And so we had already sent out the notices of the application. That's a requirement of our office to do. And so we have received those applications. So at the very first board meeting, we will have a bunch of grant applications to review and vote on. Because the previous board had been dissolved, we could not vote on them prior to. So we have a lot of grant prevention partners who are eager to hear whether or not they've been awarded funds. The state board shall meet not less than quarterly at the call of the chair. And so the very first meeting, I'm excited to announce, is August 23rd, and it'll be held at our East Campus at the OAG. And we're going to have it so that people can attend virtually as well. So we're going to try to make it as easy as possible for people to attend. And anybody that wants to be on the list of getting the invitations, it's open to the public. We welcome anybody to come, but we're very much looking forward to the start. Some of the many items on our agenda: reviewing the grant applications. We've already received the 26th annual Kids Are Worth It Conference Scholarship application that Prevent Child Abuse of Kentucky has put forth. And so that'll be something on the agenda, whether or not they're able to fund for law enforcement officers to attend that training. We'll talk about subcommittee structure and membership discussions. We're going to establish our meetings, vote on bylaws, and start beginning our recommendations for the annual report. One of the other things that Senate Bill 8 included was to include the board in the Child Victims Trust Fund as part of the Kentucky Employee Charitable Campaign. And so I met with United Way earlier today, and so I have a meeting tomorrow as well as next week talking about how we are going to get started. But we are one of 9 charities that are kind of partner agencies with the KECC, if you're familiar with that term. And so we're very excited about that opportunity to raise additional funds and awareness about this board and what we're able to do. Do you have any questions?
All right. Well, thank you very much, Heather. That was fabulous. And one of the things that I really like about your presentation is that you have a lot of energy and you're very enthusiastic about it. And I think that's exactly what this task needs, is some energy, and all with the combined purpose of really helping kids and protecting kids in the Commonwealth. So thank you very much for that. And I don't know, does anybody on the committee have any questions for her? All right. Thank you. Okay, it looks like next up we will have Mary Carpenter, Kelly, and Laura. And then if you all could just take a seat, introduce yourselves for the record, and please proceed.
All right, good afternoon. Thank you very much for allowing us the opportunity to present and provide an update on the implementation of Senate Bill 8. My name is Laura Began, and I am a staff assistant, regulation coordinator for the Department for Community-Based Services.
Good afternoon. I'm Kelly Root, and I'm an assistant director in the Division of Protection and Permanency.
Good afternoon. I'm Mary Carpenter. I'm an executive advisor in the DCBS Commissioner's Office.
All right, getting into Senate Bill 8. Just like Heather, I think you'll find that we are enthusiastic about implementing this bill as well. This is comprehensive child welfare legislation sponsored by co-chair Senator Julie Rocky Adams. It brought together many partners working across the child welfare continuum. You're going to hear us talk about portions of the bill, again, affecting all through the continuum, talking about how we provide services to children and families to keep children with their families, keep them from entering the state's custody, to what happens when a fictive kin caregiver needs to be identified if a child does need to be removed from their home, all the way to providing supports for youth when they transition out of the state's custody, somewhere between the ages of 18 and 21. Senate Bill 8 promoted child welfare prevention. We're really going to get into child welfare prevention in the following presentation, but we're going to touch on the surface of it because Senate Bill 8 allowed us to provide more family preservation services, more families, services to families upstream. And again, Senate Bill 8 increased services for children, youth, and families. So we're going to dive into specific portions of the bill, how they change what's already been done, and our implementation of them since the bill went into effect.
Right. So a really important piece of the legislation was to amend the definition of fictive kin to really expand to allow more individuals with significant relationships, specifically to children that are infants to 12 months of age. And what this does is really include emotional relationships with a bio parent of that infant child, a sibling, or a half sibling of the infant. So it allows us to really broaden the scope of who we consider fictive kin, especially for these very young children as they enter care. So currently there's over 1,300 of children in custody of the cabinet who are placed with a relative or fictive kin provider. And we look at these relative and fictive kin placements first. As we know, it really reduces trauma for children if they are having to leave their home to be placed with someone that they have a significant or an emotional relationship or connection with. And this has really impacted what our out-of-home care numbers have looked like over the past 4 years. So you see the downward trend on this graph here. And if we were comparing apples to apples, it would be an even lesser number of children in care. So historically, we when we worked with relative caregivers or fictive kin caregivers, we would historically not bring those children into state's custody, and they would be placed in the temporary or permanent custody of that relative caregiver. But in April of 2019, we launched the Relative Service Array, which then allowed a pathway for relative and fictive kin caregivers to pursue foster care approval and in turn receive all of the supports that came with being a foster parent. So in August of 2016, the first data points that you're seeing on the graph, only 336 of the 7,894 children in care were placed with relatives. And so that was about 4.3% of our population. By contrast, in May of this year, 1,494 of the 8,760 children are in foster care placed with a relative. So that has increased that percentage up to 17%. So if we were practicing the same way as we were in 2016 with regard to relative placements and how we place children with relatives, our out-of-home care numbers from 2016 would actually be lower today than they were 6 years ago. Senate Bill 8 also included measures to assist the department in fulfilling putative father requests. The putative father registry is administered by the Adoption Services Branch in the Division of Protection and Permanency. And this registry was established in 2018 through House Bill 1. And the purpose of this registry is to find a father who may not be named or disclosed by the mother of a child. And so if a petition for adoption is filed, the putative father registry may be searched so that a father could receive notice that his child was involved in an adoption petition. So who is a putative father? It is an individual that is not married to the child's mother on or before the date of the child's birth, and an individual that has not established paternity of the child in a court or agency proceeding in this state before the filing of an adoption petition, or has not completed an acknowledgement of paternity before that child, a petition is filed. So to date, we have had 43 putative fathers registered on the putative father registry. 45 registrations has been denied as they were received outside the established timeframes in the statute. In those timeframes, a putative father has, during the pregnancy and up until 21 days after a child's birth, to submit a registration request. And the putative father search, a registry must be searched prior to the finalization of an adoption. There are exceptions, and those include an adoption involving a foreign-born child, an adoption that is initiated outside of the state of Kentucky, and then a public agency adoption. And so here's some numbers just in regards to search requests. These searches are completed and requested by attorneys, private agencies, out-of-state child welfare agencies, and as you can see, the numbers, we're at 765 for 2019, 1368 for 2020, 1376 for 2021, and for 2022, 510. And you may note that looks like that we're not on pace for previous years, and we have really seen, due to the relative service array and relatives being able to become foster parents, they are no longer having to file an independent adoption petition, and they're able to adopt through foster care. And so they are not having to go the private route in order to adopt that child. So we have seen that decline, and we think that is shown here in this decrease of numbers as of this June.
So shifting gears a little bit, another impact of Senate Bill 8, our department has really been focused on differentiating between poverty and neglect. Kentucky is ranked 5th in states with the highest poverty rate in America and ranks 17.3% of our population living below the poverty line. So the 2021 poverty threshold for a family of 4 is an annual income of $27,575 according to the Census Bureau, and the average child care cost for Kentucky is a little over $6,000 annually. So we've really been focused since the implementation of Senate Bill 8 of educating our staff on what those systemic factors are around poverty, and working to educate our community partners as well around those systemic factors around poverty and differentiating between poverty versus neglect. So Senate Bill 8 amended the definition of what an abused or neglected child means, and specifies that a parent or caregiver's inability to provide for their child due to the lack of finances or financial assistance is not neglect. So the World Health Organization defines poverty as when an individual or household income is below what is needed for sustenance. Neglect refers to the failure of a parent to provide for the development of the child where the parent is in a position to actually do so. In the areas of health, education, of emotional development, nutrition, shelter, safe living conditions, and it's in the case where they actually have the resources to provide for those children. So we've been working to make changes to really update our policies to educate our staff and educate our community partners so that findings aren't made in investigations when solely due to lack of resources for families. So in this slide, this is types of maltreatment. Child Protective Services reports with a substantiated or services needed finding for children that are removed and placed in foster care. So you can see that overall, and this is for state fiscal year 2016 to state fiscal year 2022, that we receive the majority of our reports are for basic neglect and risk of harm neglect. And this data is important. We use this for missed opportunities around prevention and think as we really try to educate our staff and the differences between poverty versus neglect and work with community partners in differentiating poverty versus neglect, that we will hopefully see this number trend down. There's a lot of research that supports that as we work to provide families with economic supports and concrete supports around public assistance, that the actual maltreatment that is experienced by families will decrease the more concrete and economic supports that they receive. So we have been working, of course, to expand our prevention services, and specifically with Senate Bill 8, it contained an amendment that allows for family preservation services to be provided for children who are at moderate risk of being removed from their home, rather than only being at imminent risk. So this allows us to intervene sooner and further upstream, rather than waiting until those families are at the point of actually having to be removed from their home. And this is consistent with the federal language with the Family First Prevention Services Act, in which Kentucky was an early implementer in 2019. So this is some of our programs that we're using under the Family First Prevention Services. Of course, we see really positive outcomes from our evidence-based practices. Family Preservation Program is a statewide program that's an in-home services program that serves 0 to 17 and is in every county in the state. And then our K-STEP program is and START serves families at risk of substance use disorder. And with K-STEP, a child has to be, at least one child in the home has to be 10 or under. And with the START program, it serves 6 and under. And then we see 92%, this is state fiscal year 21, percentage of children remaining in the home at closure, 92%. So this is a really successful program.
And I'm really excited to tell you about the last two portions of Senate Bill 8 because they were strongly advocated for by the Voices of the Commonwealth. I know many of you have met with or heard from the Voices of the Commonwealth, but for those who don't know, they are a Kentucky organization for foster youth and foster youth alumni aged 16 to 23. They travel across the state advocating and sharing their own personal experiences in foster care. They help recruit foster parents specifically for older youth. And they educate other foster children about the resources that are available to them and educate them about advocating for themselves. The Voices of the Commonwealth have really been important. They've been an integral part of legislation that's passed the past few years. In 2017, they worked with the cabinet and the legislature to develop legislation that established a process for foster youth to obtain a driver's license because there was not a process in place at that time. Since then, they have worked with the cabinet and legislators to create a foster child bill of rights. and to expand the college tuition waiver that is accessible to foster youth and foster alumni. So they've been very vocal and very involved in increasing supports and opportunities for other foster youth. So they supported this entire bill, but and they testified in support of the bill, but they really advocated for the final two parts of the bill. This allowed foster youth alumni the ability to reenter the custody of the state after they had exited the custody of the state in order to receive more supports that we provide. And the bill expanded the Foster Child Bill of Rights, which granted them more rights related to obtaining vital documentation, so medical records, their documentation related to their involvement and their family's involvement with child welfare. It gave them the right to request to be placed in settings where they feel most comfortable. It gave them the right to participate in a sibling or half-siblings court hearing if approved by the cabinet and the judge. And it gave them the right to raise their own child while they are in the custody of the cabinet. So very important part of the legislation. To go into a little bit more detail about the extended commitment option. So previously, there was a statute that allowed youth who had exited from the custody of the cabinet to re-enter the custody once. So when a child turns 18, they can choose to exit the custody of the cabinet, or they can recommit to the cabinet up to age 21. Sometimes we find that individuals want to leave the custody of the state at 18 and then, have some struggles being independent at, of course, only 18, 19 years old. So they were allowed to re-enter the custody of the state one time up to age 19. There were some different interpretations of what this meant relating to age 19 as well. Sometimes it was interpreted to mean that they had to submit the request prior to obtaining age 19. Sometimes judges interpreted it to mean that they had to recommit. They had to have it finalized prior to age 19. So Senate Bill 8 included that they could re-enter the custody of the state up to 2 times and up to age 20. And they only have to submit that request to re-enter the custody of the state. It doesn't have to be finalized prior to age 20. So then we're able to provide them more supports as they transition to adulthood. So DCBS immediately updated our policies when this went into effect on April 1st, and we updated the Kentucky RISE Resources for Independence, Success, and Empowerment website to reflect these changes so that youth and caregivers would know. I've included a link to the Kentucky RISE website. If you haven't checked it out before, it's really great. It contains lots of trainings for foster parents and other caregivers, lots of information about resources available to foster youth and caregivers, potential adoptive parents. So I urge you to check that out or share it with anyone you know that's interested. When we're talking about youth exiting to independence, we wanted to kind of give you a scale of what we're talking about. We strive for permanency options like adoption and reunification, but we do have youth who exit without one of those permanency options. So this includes the number of youth who have exited at age 18. They choose to leave the custody of the cabinet, or those who recommit with us and exit anytime up to and including age 21. And you can see that these numbers have been pretty steady, between 600 and 700 youth per year who are exiting to independence. And finally, I mentioned the Foster Child Bill of Rights, which expanded the rights that foster children have. Again, we immediately updated our policies consistent with this, providing more documentation and more rights to them. And the Voices of the Commonwealth have been very involved in educating foster youth about these expanded rights. They have presented at Kentucky RISE events, regional foster youth events, and the statewide Youth Empowerment Conference. And this information also has been updated on our Kentucky RISE website. And I just wanted to include that we are always inspired by them. If you've heard their testimony, heard them talk about their lived experience, it's very powerful, and they're very passionate about improving the lives of other foster youth. So it's great to see their advocacy in action. Are there any questions?
Okay, thank you very much. Great presentation. And again, it's thank you to the cabinet and you all in participating in this and working to get everything buttoned up and ready to roll. That means a lot to me. I do have one question on slide 2. You talk about the statewide children in custody are committed to the cabinet. I see that we're down to 8,684. Does that only include foster care, or does it also include fictive placement? And I don't know if we could have those. Are those two numbers different? And if we could have those two numbers.
Yes, so this is all children in our custody. So
Okay.
it does include children in foster care, also children placed with relative and fictive kin, families that have chosen to become foster parents. So we do have families that would choose to take, an informal custody arrangement, take custody. And not pursue foster care approval, but this 8,000 number does include those that are actively fostering a child. And currently, out of in May, 1,494 children are being cared for by relative or fictive kin in that out-of-home care population number
Okay.
with a foster parent.
Okay, so the 1494 that you just gave me, that is fictive?
Relative and
Relative
fictive.
and
Relative
fictive kin.
and fictive.
Yes.
Okay.
And I believe we can break that out if you want us to.
I would
think we
love that.
can.
If you can
Yeah.
go back and just break that out, just so that the
It's a
committee has
special
it.
request for us. It's not on our regular fact sheet, but I think we actually can break that out, so we can try to do that for you.
Perfect. Thank you. And that's the only question I had. First up, we have Senator Berg. Senator Berg, can you put your microphone on?
I'm sorry. Thank you. Putative father search requests. I wasn't totally able to follow you. It may be the slide before. We had 43 fathers in the state put their name on a list.
Correct.
And then we went looking. We did over 2,000 searches.
Yes. So the father during the pregnancy or until 21 days after the birth is able to place their name on the registry, saying, "I believe that I am the father for this child." So if any adoption petition is filed, those that are filing those independent petitions, attorneys, most of our requests come from attorneys, they do a request to search the registry to make sure that that father's name is not on the registry. So we definitely have many more searches than we do fathers registered on the putative father registry.
So this number, this 43, was from what year?
That is current.
This is this current year,
So we have-
2022?
Yes, ma'am.
So can we compare that number to the total number of children born out of wedlock in the state? Just so we know what percentage of fathers are actually trying to get custody of their children born out of state? It seems to me an amazingly small number here. And I think that may have some impact on legislation going forward.
Okay.
Thank you.
Okay, Representative Tate.
Thank you, Madam Chairwoman. And my question is exactly in the same subject. Have you seen and do you see the potential where this punitive father registry, the process of trying to identify the father, how that could potentially conflict with our safe haven laws? Our safe haven laws give the mother the opportunities, the family the opportunities to surrender their child up to 30 days. So do you see and have you seen a potential conflict?
I think where that comes in on slide 7, there are some exceptions, and a public agency adoption is one of those. So if a child comes in with safe haven, they would then be in a public agency adoption. So a putative father search is not required in a public agency adoption.
Okay, so have you seen where there has been a conflict between these
I am
two
not aware
processes?
I am not aware of any cases
Okay.
where that has been an issue.
No.
Yeah. I'd like to discuss with you a situation that I'm very well aware of where this has occurred. So thank you very much. Thank you, Madam Chairwoman.
Thank you. And next up is Senator Storm.
Thank you, Madam Chair. Does DCBS keep data that tracks children who have been removed, such as where they have been removed to, what homes they're currently in?
Yes, sir.
Okay. And may I ask a follow-up? Sure. And do you have any statistics or any data about children who have been previously removed being allowed to remain in a home with the same parent where they were removed from on the other children?
So do you mean if a new child was born and other children have, not that child, but other children have been removed?
Yes. So a mother has a child or two children that have been removed. She then has another child. Are those children that new child allowed to remain in the home with that mother if the other two children have already been previously removed?
It would depend on, it's case by case. So it would depend on if the safety threat that existed when those other two children were removed was still present when that child was born. So that child could remain in the home, and I'm not sure if I'm following you. So potentially that child could remain in the home, but we may not. I think I'm following you, but I'm not sure.
Yeah, I think you are. Let me ask one last question. So those two children in that first hypothetical were removed from that parent. There's an afterborn child with the same parent. Are those two children that have been previously removed allowed to reside in the same home with that parent, with the afterborn child?
You
They shouldn't.
you said the children that have been removed.
Yes. Would DCBS allow the afterborn child to remain in the same home with the same parent and allow those other two children who've already been removed to reside in that same home?
So the infant may be allowed to stay, again, as Mary said, if the same safety risk was not there as it had been with the former two, or previous two. But if the previous two would not automatically be allowed to return, they'd have a plan, a reunification plan, and it contains goals that would have to be met in order for those children to return to that home.
If the case plan had not been completed on the other two children,
Right.
is there any way to track where those children are located? Does DCBS
Yes.
follow up and make sure that those two children that have already been removed are safe?
If they're in out-of-home care, so if they're in out-of-home care, yes, we know where they're at. So if they're with a relative, like in permanent custody, we may not have an open active case. So they could be with a relative and be in permanent custody, and we may not necessarily have data. We may not know where they're at. But if they're in out-of-home care and foster care, then yes, we know where those children are.
Okay, thank you.
Okay, next up is Representative Mosier.
Thank you, Madam Chair. I am interested in how fathers get information about the putative father list. How do they know to put their names on a list?
Well, when House Bill 1 launched, we did some education around that, and we created some brochures and to try to educate the public on that, with providers and that it's on our website to advertise it and to make that aware. So just like we would any other service that we have.
Okay. And then is there any concern with, I'm interested in what Representative Tate said about the safe haven issue. Is there any concern about the father's rights if a private agency doesn't reference a putative father list when they're entertaining the idea of adopting a child out? Or maybe I'm just confused about what happens there.
So if a private agency is involved with a child that there is a private adoption on, what they do is they submit that request to the adoption services branch, who then goes in to make sure that there is not a father listed on
Okay.
that
I
registry.
misunderstood.
Yes.
Okay.
So they, staff on the adoptions branch, make sure that any of the fathers that are registered do not match this child. And then we'll notify back that agency of the results where then they can proceed.
Okay, thank you for that clarification.
Yes.
Thank you, Madam Chair.
Okay, any more questions? All right, thank you very much. I appreciate your all's time.
Thank you.
Okay, next up, we have the update on budget funding. Looks like we have Krista who's joining us today, so if you will just introduce yourself for the record, and you can begin your presentation.
Good afternoon. I'm Krista Bell. I'm an executive advisor with the DCBS Commissioner's Office and want to thank this committee for the opportunity to present on this information today. My two presentations have been combined into one. So the presentation on prevention does include child welfare data as well. We've titled the presentation Prioritizing Prevention in Child Welfare because we know that prioritizing prevention ultimately leads to better outcomes across our child welfare continuum, including the reduction of fatalities, the reduction of the number of children who enter care. When we have fewer children in care, it then allows us to provide a higher quality of care to those children, including keeping those children in the least restrictive settings, including relatives and fictive kin when possible, and allows us to ensure that they achieve permanency more timely. I know that this committee is familiar with the Family First Prevention Services Act, and Kentucky was one of the first states in the nation to implement the requirements of this act. Our increased focus on expanding our prevention efforts really began as we prepared for this implementation in October of 2019. We really do think of that as the start of our prevention journey, and we didn't just do that to meet a federal requirement or achieve compliance with a one-time initiation, but we intended this to be the foundation upon which we continue to build more robust and comprehensive prevention services for the families and children in our state. This slide shows the number of families served under our Family First Prevention Services for state fiscal year 2022. Our three primary programs under Family First Prevention Services are our Family Preservation Program, or FPP, which you see on this slide. 1,769 families were served this past year. Our Sobriety Treatment and Recovery Teams, or START, which served 163 families this past state fiscal year, and then our Kentucky Strengthening Ties and Empowering Parents, or K-STEP, that served 291 families this past fiscal year. Two things that I think are really important to note about this slide: if you see this information presented again in another month or two, it is quite likely that these numbers are going to be higher. This is preliminary data for state fiscal year 2022. This presentation did have to be prepared within just a few days after the close of our state fiscal year, and our prevention providers actually had an additional week to enter their data for this state fiscal year. So it is likely that these numbers are going to increase once we have all of the final data entered. The other thing that I think is really important to note about this slide is the way that we are counting families here are families for whom these prevention services were complete. So in order that we are counting only unique families and we're not counting families in multiple state fiscal years, we're only counting the families who completed services during state fiscal year 22. Many of these services, most notably K-STEP, increased significantly in the latter part of this state fiscal year. So we may not see that in our data until we see the numbers for state fiscal year 23, when those families actually complete those services. This next slide is one of the ways that we look at whether our investments in prevention is being effective. And I know that you all have seen, this committee has seen this slide before for previous state fiscal years. We have added state fiscal year 2022, but this slide starts with the stacked bar graph that shows state fiscal year 2019, which was actually the last complete state fiscal year prior to implementation of Family First Prevention Services. And in that state fiscal year, you can see that we spent approximately $15.4 million on prevention services that would fall under Family First. So that's family preservation, K-STEP, and START. And in that same state fiscal year, we spent about $296.5 million on out-of-home care services. With each subsequent state fiscal year, we have increased our investment in prevention services that fall under Family First. And in state fiscal year 2022, we increased those expenditures to $26.8 million, and our out-of-home care costs are reduced to $217 million. You do see that the adoption costs, which is in the green at the top of that stacked bar graph, those also have increased over these 4 state fiscal years, meaning that more children are likely achieving permanency through adoption. So in total, if you compare state fiscal year 2019, which was the year prior to Family First implementation, to our most recent state fiscal year, we've increased our prevention expenditures by $11.4 million and decreased our out-of-home care expenditures by $79.1 million. So in 2022, our greatest prevention expenditures were in 3 areas, or utilizing 3 sets of funds: our Family First programs, FPP, K-STEP, START, and our multi-systemic therapy pilots, which is also an EBP on our evidence-based practice on our Family First prevention plan. There we increased our spending to $26.8 million. We also spent $2.9 million for community-based child abuse prevention programs, and community-based child abuse prevention, or CBCAP, is federal funding that is available to states. It is intended to be for families, to be used for primary and secondary prevention services, or for families who are not involved with the child welfare agency. The whole purpose of that funding is to provide services to prevent the need for child protective services or for child welfare agency involvement. So some of those services in Kentucky you may be familiar with, like our community collaborations for children, which is in every region across our state, parent engagement meetings. Some of that money also goes to our Family Resource Youth Service Centers and to fund some activities of Prevent Child Abuse Kentucky. We also utilized $12.7 million of the state general funds appropriated for prevention. And this next slide goes into further detail about how those state general funds for prevention were utilized. We invested an additional $3.4 million in family preservation, START, and K-STEP, or those Family First services. We also spent $100,000 invested in the launch of an Intercept pilot. And I want to pause for just a second here and explain a little bit about what Intercept is. Intercept is an evidence-based practice that is rated on the National 4E Prevention Services Clearinghouse. And one of the things that I think this committee would probably be interested in that explains why we decided to pursue that evidence-based practice was actually related to a question in a previous presentation that was really thought-provoking about how do we do more to prevent children who are still going into out-of-home care. And sometimes that is about the quantity of services available, because we certainly don't want families on waiting lists where perhaps children are at risk of coming into care because services aren't available, but it's about something else. There are a lot of our substantiations are for neglect, but neglect often, and most of our fatalities and near fatalities are actually because of neglect. So neglect can still be very serious. It can be fatal for children. And so in order for prevention services to be effective, our workers, when they go out and assess risk and safety to that family, have to feel comfortable that if those services are put in place, that child is going to be safe. That is one of the unique things that I think is really different about Intercept, and I see that as a next step to really start to make a difference on the children who are coming into out-of-home care. We had the opportunity to sit in a supervisory session with another state that is using Intercept, and the complexity and seriousness of the cases and the situations for whom this service was being provided that allowed children to stay in that home were absolutely situations that in Kentucky those children would come into out-of-home care today. So I think Intercept is a really important investment that will allow us to keep children in their homes because of the intensity and the quality of services for families that today those children would come into out-of-home care. The same is true for our multi-systemic therapy pilot, which is the next on the list. We spent $156,240. I believe this committee has heard from testimony from Home of the Innocents previously about that pilot for youth with high-risk behaviors. That's a really important evidence-based practice. And in addition to Home of the Innocents, we are also piloting that evidence-based practice with two other providers in the state, including KBC and CHNK in Northern Kentucky. We also invested $230,218 in community response pilot, which I'll talk more about in just a few minutes. A little over $62,000 in the Volunteers of America pilot for families who are struggling with substance use disorder. We also invested $870,690 in primary prevention and fatherhood engagement initiatives in partnership with Prevent Child Abuse Kentucky. $384,796 was invested in the expansion of community collaborations for children and parent engagement meetings, which I'm also going to talk about a little bit more. $115,000 invested in support of our thriving families, creation of a birth parent advisory council and regional visioning sessions, which I'll talk about in more detail. And then $7.4 million invested in support of qualified residential treatment programs. You saw this slide in the previous.
I'm sorry, can you expound upon the $7.4 million invested in qualified residential treatment
Yes,
programs?
there was actually another point I was going to make about that slide, so I'm happy for the question.
Okay.
The bullet points that you see in red are actually programs that all fall under the Family First Prevention Services Act. So the Family First Prevention Services Act not only allowed for the use of evidence-based practices in order to leverage federal funding for the first time ever, but it also created qualified residential treatment programs for states, as well as kinship navigator supports. So the qualified residential treatment programs set forth a new set of requirements for congregate care providers in the state that required them to utilize curriculum or modalities with trauma-informed care. It requires aftercare supports. It requires family engagement. So the family has to be involved in the treatment planning for that child. That is a key component. And so in many ways, this was intended to be, Family First was intended to be a comprehensive approach to prevention and child welfare, and to change the approach to child welfare and qualified residential treatment programs are congregate care providers, but it's also tertiary prevention, in that those additional requirements in working with families, continuing to provide services to families once children exit care for at least 6 months, is tertiary prevention in the prevention of future maltreatment, and also prevention of having to need that residential level of care in the future. It provides greater support for those children to remain stable in their homes once they return.
Okay, so qualified residential treatment. So give me an example of who is the recipient of the residential dollars. Is it like Brookline?
Sure, yes, it is.
Okay.
So all of our residential providers, private child care, PCC is the acronym that we use. It is the providers that you are familiar with. Prior to implementation, we provided those standards to providers. They applied to be approved to demonstrate that they met those federal requirements for what a qualified residential treatment provider is. Many of those providers did meet that prior to implementation, but even more have met that standard since our initial implementation. There are only a handful of residential providers left in Kentucky for our children in out-of-home care that do not meet that QRTP requirement. The rates for providers that were that became effective this month increased the rate for our qualified residential treatment programs, recognizing that there are additional services that are required for QRTPs that are different than the services that were previously required for residential providers in Kentucky.
Okay, and I guess the reason for my honing in on that last line item is that's the largest line item, 7.4 million. So can you just tell me a little bit about how DCBS became interested in spending the largest amount on that sheet with qualified residential treatment? What kind of ROI are you expecting to get?
Well, I think, in terms of return on investment, I think the stability when children leave that residential treatment because of the 6 months of aftercare, if they return home to their parents, there should not be re-entries into care. That is drastically different than previous practices where a child leaves residential care and the residential provider no longer provides any services to that child. So on the day that they're discharged, this is prior to implementation of QRTP. On the day that that they would be discharged, then that provider would no longer be involved. Under the QRTP requirements, that provider continues to be involved with that child and family for 6 months post-discharge. So they are ensuring that that child is receiving treatment services in the community once they're at home with their parent. They're having contact with the community-based therapeutic provider, with the parent and with the child on at least a monthly basis for 6 months post-discharge to be sure that that return home is stable, that child does not re-enter care or have to go back to residential treatment. The other component of that I think is important in terms of the stability of that return to care is the involvement, the requirement for the involvement of the parents in those treatment services while the child is there. And so that is, a really critical part of the QRTP requirements is that the child is not receiving treatment in isolation, but the parent or caregiver is involved in that treatment planning and in that child's treatment while they're at the QRTP.
Okay, thank you. And I probably will follow up post-committee on maybe some other questions I have on that item.
The next slide you saw in the previous presentation, this shows our out-of-home care trend line. This is one of the ways that we look at, potentially the effectiveness of our prevention services. Kelly did a really good job of explaining in the previous presentation that we're not really comparing apples to apples, so to speak, between 2022 and 2016. And the reason for that was that implementation of the relative service array that she provided. So if we were just comparing non-relative placements, we would actually have fewer children in care today. In June of 2022, there were 1,398 children of this 8,684 who were placed with relatives or fictive kin. So only 7,286 children are actually placed in foster care with non-relative caregivers. And that same number, non-relative caregivers for August 2016, which is the lowest number on this trend line, was 7,558. So if we were still practicing the same way that we did in 2016, there would actually be fewer children in care today than there were in 2016. And certainly there are fewer children placed with non-relative caregivers than there were in 2016. This next slide looks at the trends in our out-of-home care population a little bit differently. The trend line that you saw in the previous slide is a point in time numbers of children in care. And so that is a function of both entries into care and exits into care. This slide shows just our entries into out-of-home care, and so maybe a better way to have takeaways about whether our prevention efforts are being effective. So you can see that in 2019, state fiscal year 2019, which was the year prior to Family First implementation, there were 6,945 children who entered foster care in Kentucky. And then those numbers go down following Family First implementation, 5,590 in state fiscal year 2020, a little bit lower in 2021. And then in this most recent state fiscal year, there's 5,453. I want, again, those include those placed with relative and fictive kin caregivers. So the same differences in practice that we described on the previous slide are also relevant here. So our numbers of entries have stayed relatively low. I know that this brings up questions about impacts of the pandemic, and I'm going to talk about that a little bit more later in the presentation. But one of the things that I would want to point out on this slide is that even when children return to in-person instruction, we have not seen those entries into care go back up significantly. I wanted to talk for just a few minutes about types of prevention efforts, because I think this is really important as we think about activities and funding for prevention. Because they're very different depending on whether we're talking about primary prevention, secondary prevention, or tertiary prevention. So primary prevention are those activities that are directed at the general population and are effective in stopping maltreatment before it occurs. They should be available to all members of a community if that is a healthy, thriving community, and all members of the community have access to and could benefit from those services. So these are things that we probably take for granted if we have access to. If we don't have access to those things, then it could be really detrimental to our family. So there are things like access to high quality childcare, positive parenting campaigns, parenting books. Many of the activities of Prevent Child Abuse Kentucky fall under the primary prevention category. Secondary prevention refers to activities that have a high risk focus. So these are services and supports that are directed at families that may have one or more risk factors associated with child maltreatment. So these are things that you're probably familiar with, like the HANDS program, our Family Resource Youth Service Centers that are attached to our schools. This could be parenting classes for teen parents, respite for parents of children with special needs. And then tertiary prevention activities focus on families where maltreatment has already occurred. And the goal of those activities is to reduce the negative consequences of the maltreatment, to prevent future maltreatment from occurring, or to prevent entry into out-of-home care. So all of our Family First programs like FPP, START, and K-STEP are really tertiary prevention activities. And so we're really intervening when something has already happened and we're preventing maltreatment from happening again, or we're preventing entry into care. And we really want to focus on how we can do more in the primary and secondary prevention space so that we can actually provide services that prevent maltreatment before it occurs. So some of the ways that we can do that is that we can use our child welfare data to try to identify reasons families become involved with child welfare. We need to ensure that families have access to services when they need them. Too often they come to our attention after things have already escalated to a point that something has already occurred. So we need opportunities to provide those services before stress and crises escalate to the point of maltreatment. It's important that we collaborate with our community-based providers. For prevention efforts to be effective, they really have to be community-based, based on the strengths and resources in that community. It's important that we encourage community members to support families in times of need and to create community pathways to leverage federal funding for prevention. The graphic that is included here was actually drawn by one of our youth when she was in foster care. She is now a young adult who has left care. Her name is Teresa Ray, and she did give us permission to use that graphic and her name today. This chart shows our CPS intakes for state fiscal year 2022. So this is the breakdown of all the reports that come into the Child Welfare Agency. So that first column that you see there is all intake. So it's all reports regardless of what the content of those reports were, and just with adult protection issues removed from that. The next column is all all child protection response intakes. And so those don't necessarily have an allegation of child abuse and neglect. We do get court-ordered custody evaluations, court-ordered home evaluations. We get requests to assist law enforcement for some sexual abuse investigations in which the caretaker is not, or the alleged perpetrator is not a caretaker. The 96,978 is the number of reports that actually contained an allegation of child abuse or neglect. Of those, 40,230 met our acceptance criteria or screened in. It means that that allegation met the criteria based on our statutory definitions of abuse or neglect. Of those, only 9,485 resulted in a report that was substantiated or a services needed finding, and 7,601 of those were an actual substantiation of maltreatment. So from this, 33% of the original contacts met criteria for investigation, and 41% of those with some type of allegation met criteria. Only 8% actually resulted in a substantiation of service or services needed finding in which the cabinet would provide ongoing services. And I think that information is really important because what that means is the vast majority of the reports that are coming into the agency don't meet statutory criteria for the cabinet to take any action at all. And I'm going to talk a little bit more about that because it is an incredible missed opportunity for prevention. I did want to talk first, and you saw this slide in the last presentation as well, but this breakdown of the type of maltreatment that we are seeing also paints a picture about missed opportunities for prevention. Neglect is by far the biggest reason for substantiations that lead to entry into care, and this is true in Kentucky as well as across the nation. Physical abuse represents only 18.4% of entries, while sexual abuse is only 6.5% of entries. One of the things that I want to point out here, and also in the previous slides about entries into care, is that even though we've seen fewer entries because of the success of our prevention services, we're still providing services to a family who are experiencing complex issues. So when we open a case to provide services to families in home, those services are often just as time-consuming or even more time-consuming than providing services in a situation where a child has been removed. And there's also continues to be a huge need for increased resources for behavioral health needs for families. And this next slide will show a little bit more of that. These are the 3 risk factors that we track for situations in which a child comes into out-of-home care. So we track the presence of mental health as a risk factor, substance abuse, and domestic violence. So this, you can see on this slide that in more than half of the cases that led to entry into care, mental health was a factor that either directly contributed to the reason for removal, indirectly contributed, or was at least a risk factor. I think that middle stacked bar graph there is perhaps the most compelling and certainly paints a picture about the needs of families in Kentucky. 52.7% of entries into care had substance abuse as a factor that directly contributed. Another 5% indirectly contributed, and 15% of cases that was a risk factor. So in total, 73% of entries into care had substance abuse as a risk factor. And then on the right there, you see domestic violence as well. So just under half of the entries into care, domestic violence was a risk factor, whether that directly contributed, indirectly, or was just a risk factor. So I wanted to share a little bit about a pilot that was launched in this past state fiscal year. It is a community response pilot called Helping Others and Promoting Empowerment, or HOPE. This relates to the information that I just shared, that less than 40% of reports that come into the cabinet meet criteria for the cabinet to take any type of action. That means that, a family had some kind of challenge or crisis or struggle that rose to the level that someone felt it was important to make a report to the cabinet. And because that concern did not meet the statutory threshold of abuse or neglect, the cabinet was not able to take any action. These are families that really need some other type of support or service in their community. And as I said, I think that community response response is perhaps our greatest missed opportunity for prevention, because there's no formal structure today for those families to be referred to any other type of supports or services. So this community response pilot is for those reports that don't meet criteria for acceptance by the cabinet for assessment or services. The overall goal, of course, is to strengthen families, prevent child abuse and neglect, and reduce future reports to DCBS. This in turn will reduce the burden on our CPS staff, freeing them up to use their resources and time to focus on the most critical safety issues. This community response pilot has launched in Barron, Clark, Montgomery, and Perry counties. We've done this in partnership with Gateway Children's Services, who will be serving Clark and Montgomery counties, and our Family Resource Youth Service Centers, who will be serving Barron and Perry counties. This pilot will be formally evaluated, so it is a 2-year pilot with a formal program evaluation, and we hope that the results of that evaluation will give us good information about next steps for expansion, and perhaps to support funding for expansion to other counties. The timing of this pilot was really perfect because of the passing of Senate Bill 8. The intentional effort to distinguish between poverty and neglect is very relevant to this pilot, because most of the issues for which families will be referred do relate to poverty. Some of our other primary and secondary prevention efforts include parent engagement meetings. We expanded those to 14 counties in this past state fiscal year, and that program served 579 families. So this program is for families who are struggling with truancy and school-related issues. They get referred to the parent engagement meetings. So these are reports that would, if these services were not effective, would become reports of educational neglect to the cabinet. So that program has been 85% effective, and that 85% of families served do not have subsequent reports of neglect to the cabinet. This has also benefited the school systems financially because their attendance is better. The students don't have lost days in the school system for instruction, and families are supported and do not have to become child welfare agency involved. We've also increased in-home service provision under our community collaborations for Children, which was an existing program. That program served 568 families in state fiscal year 22. We also, in partnership with Prevent Child Abuse Kentucky, launched a Lean on Me initiative and invested in fatherhood engagement activities. Lean on Me was modeled after a similar program in Arizona. This initiative was led, as I said, by Prevent Child Abuse Kentucky and focused on the creation of positive messaging, which included specific and tangible ways that a community member could assist families in their community when they observe that they're struggling. We also know that these fatherhood engagement efforts are important because research shows that children who have engaged fathers are less likely to suffer maltreatment. And that fatherhood engagement initiative was able to reach all parts of the state. So there were participants in that throughout our entire state. Some other states have created community pathways to be able to leverage those Family First Title IV-E prevention funds. So in Kentucky, our definition of candidacy for foster care, which is what makes a child eligible for those 4E prevention services, only includes substantiations or cases in which the child welfare worker has made a determination that the family is in need of services, and it requires an open case with our agency. With other states now having their prevention plans approved, we have seen other states that have been more creative in their definition and have created community pathways to be able to leverage additional Title IV-E funding. And this is something that we plan to pursue as well. So, for example, our multi-systemic therapy pilot for youth with high-risk behaviors now can only serve youth in which the child welfare agency is involved. If we are successful in creating community pathways under our definition of candidacy for foster care, then a youth who is court involved, for example, or involved with the Department for Juvenile Justice would be able to access those prevention services without having to be involved with the child welfare agency. This could also be true for youth who in families where there is an adoption disruption. There are a number of different categories where community pathways could be effective and would ultimately prevent children from entering out-of-home care, but would not require the cabinet to have an open child welfare case with the family. We're also working to implement alternative response, which is a different approach, would allow the cabinet a different approach in working with families. So it doesn't require a finding or a substantiation of abuse or neglect for situations in which the allegations are lower risk and in which the worker has assessed that there are no safety threats. But it would allow the worker to work with the family in a different way, help them assess their needs and identify services to meet those needs without that parent having to go on the child abuse and neglect registry and without a finding of abuse or neglect against the family. I wanted to talk just a little bit about future funding for prevention. The agency is really being very thoughtful and intentional about approaching expansion of prevention services in a way that is sustainable long term. We have been reluctant to do things with one-time funding without a plan and means to sustain that. So really trying to be thoughtful about the things that we implement now, how they will be sustained in the future. One of the things that is really important about the Family First Prevention Services Act is this Title 4E prevention funding. The match currently is 50-50. So when we spend money on prevention services that fall under Family First, then we receive a 50% federal reimbursement. However, as of October 1st, 2026, that federal reimbursement increases to the Federal Medical Assistance Percentage, or FMAP rate. Kentucky's FMAP rate currently is about 72%. It can change from year to year. It does fluctuate, but I think that we can anticipate that our federal reimbursement starting October 1st, 2026 will be about 72% federal dollars, which will allow us to better sustain expansions that we undertake in the next 4 years. Expanding our definition of candidacy for foster care will also help us to leverage federal funds, potentially for youth and families that are currently not included in that definition. And so often those youth now and families are receiving services that are either funded with state general funds or with other prevention funding resources. And so that would be another strategy to leverage additional federal funds for prevention if we are able to get an expanded definition of candidacy for foster care approved at the federal level. We also have.
Can I ask you one thing? We're getting close to 4:30, and so I was wondering maybe if you could maybe be a little quicker on the final slide, so in case anybody has any questions.
Sure.
Thank you.
We also have one-time Family First Transition Act funding, which was intended for states to help implement their Family First services. It is one-time funding, so we need to be thoughtful about how we utilize that in a way that allows us to sustain those services long-term. We also have one-time CB CAP funding, which is a supplement, which also has to be used by 9/30/2025. And then other funding sources that support prevention include TANF funds, Title 4B funds, and Child Victims Trust Fund funding. There are other states like Wisconsin that are using their Child Victims Trust Fund funding to support community response. The next slide is about Thriving Families, Safer Children, which is a national commitment to child well-being. Kentucky did join this at the beginning of 2021. They were selected as a round 2 jurisdiction. This is a joint initiative by large national partners, including the Children's Bureau. It was really intended to be a movement to rethink the approach to child welfare, really thinking about how we support community and family well-being rather than being reactionary. Some of Kentucky's priorities were the creation of formalized structures to serve families screened out, or that community response, differentiating between poverty and neglect, which we have a huge head start on thanks to Senate Bill 8, and the development of a statewide collaborative primary and secondary prevention plan. The Cabinet, in partnership with Thriving Families, Safer Children Partners, has launched a formal statewide prevention collaborative. It was formed in May of 2021 and convenes quarterly. It has more than 120 members that include stakeholders and families with lived experience. This group actually developed a formal primary and secondary prevention plan that I just mentioned, and it's the first time that our state has ever had that. It was informed completely by stakeholders and not by the Cabinet. This collaborative allows for the alignment of prevention efforts across agencies. We know that we have good prevention efforts going on at the community-based level, but often that work is in silos, so the collaborative allows the sharing information so that we can be more aligned in our efforts. One of the key features of the collaborative is that prevention efforts should be community-based and family and youth-driven, because who knows better what families need better than the families themselves. And then we did in May and June have regional visioning sessions for prevention in partnership with Kentucky Youth Advocates, who facilitated those in every region across the state. The Thriving Families team and Kentucky Youth Advocates, in partnership with DCBS, have also launched a Birth Parent Advisory Council. This is really similar will serve the same purpose as our Voices of the Commonwealth, which, allows for our young people who have experience in care to have a voice. Recruitment and interviews have already occurred for that, and that group met for the first time in June. It will create an opportunity for feedback, co-design, and a voice in policy making for issues that affect families. We did wait anxiously, at the beginning of the pandemic to see if the predictions would be true. There was a lot of concern. You see real headlines there about what would happen when children return to in-person instruction. There was a lot of concern that reports to the agency were going to skyrocket. This next slide shows the reports that met our acceptance criteria for 2020, 2021, and 2022. So certainly there was an impact of the pandemic. You can see at the end of state fiscal year 2020 that that trend line trended down, but you can see in state fiscal year 2021 and 2022, those intakes have remained relatively flat and have not returned to pre-pandemic levels, even after children returned to in-person instruction. This next slide shows the intake slide that I showed previously just for this state fiscal year. But this shows the past 3 state fiscal years. So you can see the comparison there, broken out by the way that I broke it out previously and what we're seeing in each state fiscal year. And so you can see that the intakes have not gone back up significantly. They certainly have not reached pre-pandemic level. And although there is not probably a singular reason for this, we have reason to believe that the provision of economic and concrete supports is a contributing factor. On this last slide, I won't read this to you, but this is a study that relates to state spending on public benefits and how that drives down child maltreatment. So this study included all 50 states and DC and showed that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a 4.3% reduction in child maltreatment, 4% reduction in substantiated child maltreatment, 2.1% reduction in foster care placements, and a 7.7% reduction in child fatalities due to maltreatment. There is a link to the full study there at the bottom of the slide. I would really encourage you to take a look at that. It has a lot of good graphics and information that I think would be really helpful. The one thing that I want to share, I selected this one because it relates to state spending, so I thought it was appropriate for this committee. However, there is a plethora of information on topics similar to this. There is a policy brief by Chapin Hall on this topic that I think is really helpful. So I would encourage you not to take my word for it, but certainly to look at those things for yourself. There was actually an article that I saw for the first time. It just came out this morning from the American Academy of Pediatrics by this same author, Dr. Pools, Claire Anderson from Chapin Hall, and a third author whose name is escaping me right now, but it is about the provision of universal child care and how that drives down maltreatment. And so I think, the point of providing this information is that in one of the poorest states in the nation, that we really can't have meaningful conversations about prevention if we're not having conversation about the provision of economic and concrete supports to families.
Thank you. I think you should be an auctioneer because you're so fast in talking. So I appreciate the information. And I do also enjoy that it was exhaustive because, everybody that sits on this committee is really interested in these topics. And this is the purpose for the committee, is to take a really deep dive into making sure that the policies that we promote and the dollars that we put behind them are being very well spent. So I do thank you for your presentation. It was excellent. Senator Berg has a question.
Thank you, Madam Chairwoman. And my question, I think, starts on slide 6 and then jumps to slide 11. If we could go back to slide 6, I was trying to actually find if we have a denominator. No, wrong slide. I'm sorry. It's slide 3. Slide 3. I'm sorry. Yeah, here. The number of families that we're treating, which, estimates to about 2,000 off of this slide, versus the number of families in need of treatment, which if we went on, looking at some of these numbers, we're serving less than 0.1%. So do we have an actual denominator? How well are we meeting everybody?
So I certainly cannot give you that number sitting here today off the top of my head, but I will tell you that when we were preparing for implementation of Family First, we did do work around putting together numbers of who would be our total population that could meet that definition of candidates for foster care. I think that we can probably pretty easily pull that number together for you today, that would give you an idea of the total number of families that at least meet the definition of candidates for foster care. What I would caution against a little bit is what I was saying a little bit earlier, is that the other piece of that, so it's not just about the number of families who meet the definition and the availability of services. The particular circumstances of that family also have to be such that when that worker assesses risk and safety, that worker feels comfortable that if they do not remove that child is going to be safe with those in-home services. So that's what we can't really show you as much in the data. So I can certainly give you, I think we can pull together and give you that total number of families or children that meet the definition of candidate for foster care. I would just ask you to have that sort of in the back of your mind. And some of those factors are not all parents are willing to participate in those in-home services, and that certainly would have to be a criteria for those services to be effective.
Okay, just wondering how much of the need there is are we actually meeting is
Yes.
my question. And then may I have a follow-up, please? Looking at data, particularly the turnaround study, and looking at what we should expect in this state going forward. Data that we have on women who have been denied abortions, approximately 90% of them end up keeping those children. They do not place them for adoption. And of those 90%, some states as high as 52% end up needing public services or in the care of the state because the pregnancy was not optimal to begin with and the mother is simply not able. Are we looking forward, anticipating what type of increases in needs we expect from your department going forward in this state?
I will probably have to take that question back. I'm not sure that I can answer that today. I can tell you that I have not personally been involved in conversations related to that issue, but that does not mean that they're not occurring somewhere else in the department.
Yeah.
So yes.
If we're going to be forward thinking and we're going to be prepared for the needs that we have, I think we need to take some of the data that we know exists, try to extrapolate what type of needs we're going to be anticipating in the near future, what type of funding we're going to need for that, and how we're going to supply those needs. So thank you.
Yes.
Co-Chair Mead.
Thank you, Madam Chairman. Can we go back to slide 20 and 21 real quick? Thank you. Krista, if you don't care to explain these two slides to me again, and the only reason I ask that is because on Tuesday in the Health and Family Services Task Force meeting, what was said by one of those sitting at that table was that what we saw when it came to this topic right here, what we saw was far worse than anticipated by not having eyes on those children for a year or 2 years. Can you explain that kind of a contradictory message right there?
Sure. I understand the question, and I can see why it would seem that is contradictory. It is certainly not worse in terms of the numbers. And I unfortunately, I didn't hear the comment that you're referring to, so I'm not sure that I have
did.
the-
I believe the severity of the case is what was being referred to. So not the actual numbers, but our community partners have spoken to the cases being more severe, the abuse being worse.
Those children remaining in that situation, and is what it kind of boils down to, more of that situation becoming worse as they remain in that situation. Is that what you're saying, or?
That's been indicated by our community partners.
Okay.
Yes, I know Dr. Curry has testified about the cases that she's been a part of.
Okay.
Being more severe.
All right. And then my other question is back to slide 5 and 6. When the prevention services money was appropriated by the General Assembly, there was $20 million, and that was to be utilized by July of this year. So we utilized $12.7 million of that. So that would mean that $7.3 million would then lapse back to the general fund. Is that correct?
Correct.
Okay. The other thing I want to say is, first and foremost, you have done a phenomenal job over at DCBS, and you're a rock star over there. You know more than probably anybody that I've dealt with over there, and you've done a fantastic job. So none of my next comments are directed towards you or any of these folks sitting out here today. You all do a terrific job over there implementing the laws that we pass. So you really do wonderful work, and you have wonderful hearts. I know that. But I take a little bit of issue with the $7.4 million that was used for qualified residential treatment programs. And the reason for that is I know it's needed, and we need to increase that in a way. But this was one-time money that was supposed to be used for programs that, once expanded, what we were told, would sustain itself going forward. It was also supposed to be used for prevention services that help hold those families together before they entered state custody. Qualified residential treatment is used after that child enters the system. It is not, in my mind, really prevention services. It's a recurring cost spent with one-time money, and it places an even bigger burden on us in the General Assembly in the next budget because of that recurring cost. And again, I understand that need for that residential treatment. It's well needed, and we can hopefully work to increase that in some way later on as well. But it needs to be done, and it should be done by a budget request that reflects the recurring costs that it is going to occur and will generate. The General Assembly can then decide when and how to fund it. It's not up to the governor or his administration to decide to place this type of additional ongoing cost on the state by circumventing the budget process. And it's not a responsible approach to spending the taxpayers' money. We knew that the entire $20 million couldn't be spent in 1 year, and we were willing to go ahead and extend that time once we got to July of this year. However, many of us feel that this administration has not been good stewards of that money when it comes to this particular incidence of spending one-time money on recurring costs. Now, ultimately, we'll probably extend the time because I believe in it. I'm passionate about prevention services. I believe that we can hold families together and we can keep kids out of care if we expand these programs. And so we will probably do that. But the money that the cabinet was given in the 2021 session, in my opinion, in this instance, was not spent appropriately. But the speaker and I are going to sit down and discuss doing a work group to determine how and when the rest of this money will be spent, and hopefully we will come to a good solution on expanding these prevention services as we go forward.
Any comment?
We can certainly take that message back to the cabinet. My only comment related to that, I do hope that the slide that followed about the future funding prevention perhaps in some way is helpful in terms of strategy and the cabinet and specifically those who work in the area of prevention, how we're thinking about how to be able to blend together one-time funding with federal funding with the general funds that we are fortunate enough to receive through the General Assembly for the purpose of prevention, so that we can be very strategic in how we serve families. We did, one of the major areas of focus this past state fiscal year was the expansion of our K-STEP program. It is more than 93% effective in keeping children at home with their families. It is a phenomenal program, and it is definitely keeping children from entering care who would otherwise come into care. We did expand that into our entire Salt River Trail service region. We also, our intent was to expand that into our entire Cumberland service region. We could not get a substance use disorder provider to contract with us to provide those services for half of that service region. So I'm not making excuses, but just sharing information that it was a very significant challenge. Our prevention staff were very diligent in actually seeking out potential service providers and practically begging them to contract with us. The reason that they were not willing to do that is because of their difficulties with hiring. What they indicated to us is that if they engaged in those contracts, they would not be able to fulfill the scope of work because they could not hire the clinicians. They were really struggling with hiring challenges. And so unfortunately, we did see some barriers with implementing services that we had planned specifically with regard to K-STEP. But I think those hiring challenges are true for a lot of the partners with which we partner for these prevention services. It's true for our own department as well, and for our residential providers. So we're seeing that across the board, that hiring challenges really are a significant barrier. And unfortunately, it has not allowed us to ramp up with the speed that we would have liked. And again, that is absolutely not an excuse, but just sharing information about challenges that we encountered that we were not anticipating.
And those were some of the things that we kind of anticipated and knew that you wouldn't be able to spend that money. And I, first of all, I'll say you, but I know that these decisions for spending this money is made at a much higher level. But and then I also know that many of these wonderful programs that we have implemented and expanded on, and some of these pilot programs have been partially your idea. So these are great programs, and I think we only just disagree on how the money was spent on one particular item. And I think that ultimately we will extend the deadline to be able to spend this money.
Representative Tate.
Thank you very much, Madam Chair. So I'm glad you brought this slide up because this is exactly where my question was. And if you could elaborate, and you might just have, and I've kind of misunderstood, but can you elaborate on expanding the definition of candidacy? And
Yes.
is that in the areas that you're talking about, or is that specific? Because I want to make sure that we're not promoting behavior that's not conducive to keeping families intact just for the sake of getting additional federal funding.
Sure. And that when I use that terminology, that is actually the terminology that is in the federal language in the Family First Prevention Services Act. So in order to be able to claim for federal reimbursement at 50%, the child being served by those prevention services has to meet the definition of a candidate for foster care, meaning that they are at risk of entering foster care if they do not receive these prevention services. And so the federal law did allow each state to set their own definition of candidate for foster care in their and their Title 40 prevention plan, which gets submitted to the federal level and then has to be approved at the federal level. Kentucky was among the first handful of states. We were really, I think, very bold in implementing in 2019. There are actually even today, almost 3 years later, there are only 23 states with approved 4E prevention plans. So we were far ahead of other states, and I think we're very glad that we did that. But what I will say is that we were not very creative in our definition of candidate for foster care. We stuck with a more traditional definition, meaning that there was a report to the Child Welfare Agency. Our staff went out and assessed risk and safety for that family. In order to be a candidate, either there has to be a substantiation of maltreatment, or our worker has to have found that the risk is so great that that family is in need of services in order to prevent maltreatment. What we're seeing now with other states submitting their 4E prevention plans is that other states have thought a little bit more outside the box. And I think there are a lot of good examples there that we could follow. And so they are considering those populations that we know are at risk of entry into care. So it is, for example, I can name off a list of them, but it is your court-involved youth. So youth who become involved with the court, become involved in DJJ, very often subsequently become foster children. So once they've completed that treatment or the court is no longer involved with them, very often they still can't return home to family. They end up placed with the Child Welfare Agency. We also have children who come into care because they have behavioral health needs that their families cannot meet with their private insurance. And so there's not any abuse or neglect, but they come into foster care because that is the only way the family can access appropriate treatment for that child. So that's another population that really, I think that we can make a justification that they're a candidate for foster care. Some other states have used populations like families who are struggling with substance use disorder. You saw that in our own data, that's a really significant factor. So that, potentially could be a community pathway. And when I say community pathway, what that means is if we can change the definition that it doesn't require substantiation by the Child Welfare Agency, then the federal law actually would allow an approved community provider. The Child Welfare Agency only has to certify that that child meets the definition of candidate for foster care. They don't have to have an open case under the federal definition. It's the way that we structured our definition in Kentucky that we do have the opportunity to make an amendment and change that. So we're just trying to be creative about how we can serve more families in the future if we were to make changes to our 4E prevention plan, submit that to the federal level, and then get that approved. But we know that there are populations who are at risk of entry into care that perhaps could be served through these community pathways without having to burden our child welfare staff with having to have an open case in order to create a pathway to obtain those services. And so those are the things that we're having conversations about now. I do want to set realistic expectations. It's a long process to amend your federal plan and submit that and get that approved at the federal level. So we're probably talking about at least a year from now, and that might be optimistic because it would also require changes. It would require interfaces to exchange information with a community-based provider in our child welfare information system. So there are programming changes that would have to happen, but these are conversations that are actively going on right now. But it would be an opportunity that we are not taking advantage of right now to leverage federal Title 4E funding for prevention services, for services that now are either being provided and funded through state general funds, through our community-based child abuse prevention funds, but they're being funded in other ways, or they're perhaps not available to families.
Thank you. May I ask a follow-up question, please, quickly? Yeah, and I appreciate that, and I realize that this the plan was submitted in 2019, and so I always like to use the term that we have the right to get smarter. So I was going to ask you that follow-up question is, I'm assuming after the time has passed and because other people have submitted, other states have submitted, that we have gathered additional information. Prior to that submission to the federal government, if there are adjustments to our plan, is there a legislative requirement for us to be involved in that submission, but prior to submission?
No, it's really an administrative function with the Child Welfare Agency and the Federal Children's Bureau. So We actually have a pending. We've already submitted one amendment to add additional evidence-based practices. We actually have a pending amendment awaiting approval now to add intercept that as an evidence-based practice, which I mentioned and explained in the presentation, which will allow us to serve families that are dealing with really high-risk situations. But this would be another plan amendment that we could submit later.
Thank you. I guess there's a risk, going back to Representative Means' point, there is a risk then that there could be some submissions of adjustments to the plan that potentially with funding. Okay, thank you.
Thank you. Before we adjourn, I was wondering if my co-chair had any final comments.
Thank you. I actually would like to say a couple things. Again, thank you all so much for being here today. Thank you for what you do. Thank you for the work for the children of this state, the families of this state. You do a remarkable job. And I do hope that in the near future that the commissioner will attend one of these meetings personally. We would like to see her here as well. But with that said, what I would like to say is, Krista, we know that tomorrow is your last day, I think. And you have done an excellent job. And we appreciate all that you have done as well for the state. It's going to be a tremendous loss at that cabinet without you there. You've always been, as I've seen from you, in a good way, you've always been able and been willing in a professional way to tell it how it is. And so we appreciate that also. And the data that you've brought to us, the help that you've given us over the years to start a lot of this reform that we have done from our standpoint, we really appreciate that. And we wish you the best of luck as you go forward.
Thank you very much. I really appreciate that. Thank you for the opportunity to come and share information. As you all can probably tell, I could talk about it for hours. So I appreciate your all's patience with me, and thank you for the opportunity to share. It really has been a privilege to be able to come here and share information and work in partnership. So I appreciate that. Thank you.
All right. Well, I appreciate if there's our next Child Welfare Oversight and Advisory Committee meeting is going to be on Wednesday, September 14th at 1 p.m. So mark your calendars. And if there are no objections, I move for adjournment. We are adjourned. There's your thing.